Okay, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment. You've got a shaver and it has a little bit of suction attached to it, so we can flush out the knee. Right out of the gate, we can see a loose piece of cartilage here. One of the reasons why you were getting that clicking and some pain in the knee. We can turn on the shaver and start to flush the knee out with some salt water, and at the same time, hold the camera just for a second, remove that loose piece. Which is what we're working on right now. Turn my pressure up about 10, pump pressure. So, piece is big enough, we may need to put a little grasper on it, but it looks like it's working pretty well right now. We'll get a grasper ready just in case. Okay. Okay, so turn my outflow on just a little bit. Uh-huh. Uh-huh. Turn on. Pause. A biter for the meniscus. Okay, here's the tear in the meniscus. And we're going to start with our shaver. But now that we can see, we'll go ahead and put in a pair of forceps, and we'll use this to smooth out this rough edge. Turn on. Great. And that's what we're doing here. We'll go ahead and we're just about done with, get that? Just about done with the meniscus here. Table down just a little bit, please. Great. Okay, we're pretty much done in this medial compartment here. You've got this meniscus resected back. You've got some wear and tear changes on the condylar surfaces as well. Here's your anterior cruciate ligament in the middle of the knee. And that actually looks pretty good. We'll take a look on the lateral side of the knee in just a minute here. And we can see on this lateral side where the problem is. You've got this missing area in the condyle, area missing cartilage, that is. If you look at the top of the screen, see that condylar defect? So we're going to make sure the edges are stable. But that's a defect for which we've only got a few choices. We can talk about them in the office again, but there's some injections, there's some things we can do to what's called a microfracture and adding stem cell injections, or we can transfer cartilage there. All of those are much bigger surgeries, as we discussed. But I just wanted to show you the size of that defect there as we look at it here. Let me set it straight. Okay, we're just finishing up in this lateral compartment here. I don't see any more loose edges on the meniscus, and here's the condylar defect at the top of the screen. So I think we're done there as well. There's really no more loose pieces that we're seeing floating around either. Okay, so next we will look at the patellofemoral joint. I'll show you some more in just a minute. Okay, so that's the patella, or your kneecap, at the top of the screen here. It's a little bit of the fat pad. And you've got a little bit of a medial plica here. So I don't see any significant defects in the patella. And once you get this last bit of plica, we'll have a look at the trochlea down below. So as we look here at the trochlea, this actually looks pretty good. The cartilage here looks pretty good. I'm going to rotate the camera, and we'll look down here. And as you go all the way down to the front of the knee, there we are all the way down to the front. So that looks pretty good there. I don't see any cartilage defects in the trochlea or really on the undersurface of the patella either. So we're almost done here. We're going to be finishing up here in just a few minutes and getting you back to the recovery room. This is the lateral gutter over here. There's a little loose piece we can remove pretty quickly here. A couple of them. Those will all come out with suction. There we go. Okay, so we'll put some suction on this, and then we'll finish up and get you back to the recovery room in just a few minutes. Good luck to you now, okay? Bye-bye.